In healthcare, there are a lot of market failures. We cannot just leave it to the market. It just doesn't work. This all calls for some central bodies, and that's most often government, because they are the ones in charge of taxation and regulations and policies, to decide what to pay, and to pay for whom and for what and to whom. Which providers will benefit from public money? Public providers, private providers, it all depends. These are national decisions. So this really calls for having a lot of collective intelligence, and that's what strategic planning is about. And in the 21st century, it's becoming increasingly difficult, right? Because people are more and more aware, they are informed, they want more. There's more and more demand. Countries become richer. People want more healthcare, more sophisticated. And there's a lot of technology out there. We also have epidemics of cardiovascular disease, and so the needs are also changing. So new technology, new needs. Many countries have aging populations now, issues of migrations, pandemics. All of this requires a lot of capacity, and ministries of health, departments of health in the 21st century need to be equipped to handle a lot of decisions. And that's why, as WHO, we thought it's really critically important that we provide guidance on how to manage these complex issues. So the handbook is really unbundling the issues, because these are complex issues, and it does a very nice job at unfolding the different steps and providing guidance to countries on how you establish a participatory process, how you establish a citizen platform, how you develop a decision-making process. So we for example, came up with this idea of a 3D approach. The 3D approach is data, so getting the right information, getting the right science, dialogue, getting all the stakeholders and having a conversation about what are the issues, what are the tensions that can be existing between different policy choices. And the last one is decision, which is decision by democratic bodies, usually parliaments. You have some countries who are very advanced in this process. Countries like Thailand or France have a very developed process of citizens' involvement and citizens' consultation in developing health policies. But giving the message, for example, it's very important for these 3 steps to be sort of ring-fenced, that the people who work on data is one process, people who work on dialogue, it's another one, and that the decision has to go back to citizens. So really building that voice of people, and that participatory process for collective decision. Department of Health, the Ministry of Health in the 21st century will have to do many more things, and will have a much more complex task than in the 20th century. Because of the development of technology, because of the increased awareness of people, and because of the increased complexity of the epidemiological profiles. And that realization leads to actually starting from the start, which is the people, because they are both those who will benefit and those who will decide in a democratic environment and as taxpayers. So the core message for us, for a Ministry of Health of the 21st century, is putting people at the center of decision making, at the center of the system, in the sense that a health system is not about treating disease, it's about attending to the needs of people. Starting from the people starting point is absolutely critical. First, because ultimately they are the ones making the decision. So we know that when it comes to healthcare, it's about parliaments. It's about the representatives of people, and they will make decisions based on what people mandate them to. So we've seen in the past that having technocratic approaches in which experts think they know better has a limited effect. So to the handbook, they will really find guidance on how to go about establishing a process of citizens' participation or a process of dialogue with a Ministry of Finance in very practical terms and with plenty of examples from countries who have been quite successful at doing it.